Well, first and foremost, I would say first we need to educate patients about, and not just patients, everyone, about clinical trials, because at some point we know that anyone can be impacted by cancer. So I think it really is important that we educate everyone about clinical trials, and we have a Frankly Speaking About Cancer program. In fact, right now we're working with other advocacy organizations and really taking the lead in thinking about how we can do a better job and thinking about how we can convey effectively about the benefits of participating in a clinical trial and what they can mean to people.
Sure. And there's been there's been a ton of education about clinical trials, but still there are these persistent myths. So somehow there's a disconnect between what's being communicated and what's being understood on the public perspective.
Yeah.
So I think we're trying to figure out how are the ways that we can mitigate some of those misperceptions and move the needle forward on enrollment and in clinical trials.
Another thing that we've done, we've developed a program. We worked with Dr. Jeff Balcora at UCSF and helped develop a decision support program, what we call Open to Options. And anybody across the country can access this by calling the helpline. And what's wonderful about this program is that people can call or meet with somebody in an affiliate if they have one in their area and sit down and work with someone and help create questions and understand what their concerns are and what they're understanding about what their treatment options are, and create a question list that they can take with them to the doctor. And we actually did some research around this, and we found that if someone sits down with them, this trained facilitator, that not only can people put down in their own words their understanding of their disease, of what their treatment options are, but they also can put down and can be able to convey to their doctors about what really matters to them, what's important to them. And what we found is that when patients are able to go through this program, that not only are able to reduce some of that distress and that sort of sense of being overwhelmed that everyone feels when they hear that they've got a cancer diagnosis, but they're more confident to bring up questions to their doctors. And what we found when we did our research is that 50% of people brought up the topic of clinical trials. And we found that we had a rate of, and this was with blood cancer patients, in fact, and we found that close to 10% of people participated actually enrolled in a clinical trial. And we think about the national average being around 3% or 4%, we believe that this support actually helps raise awareness and understanding, and also prompts doctors to talk to their patients about clinical trials that may be available to their patients.
I think another finding from that study was that we significantly reduced decisional regret, which I think is such an important thing, that people feel like at the end of the day they made a good choice for them, whatever the outcome was. It is really a unique tool, because if you think about it, if you ask people, what are your goals, they want to say, I want to be cured, or I want to return to my normal life. But the normal life for everybody is very different, and I'm thinking of the example of the woman who was a painter, and she used very fine brush strokes in her artwork. And her first pass at the question list was, I want to be able to continue my work. Okay, I think a lot of people would say that. But when we sort of took her through the process, what ended up on her question list was, I am a painter. I need to be able to use my fine motor skills. And it turns out that she was being offered treatment. One of the treatments would have a significant likelihood of developing peripheral neuropathy. She wouldn't be able to hold the brushes. She made a different decision based on that conversation with her doctor, but that very specific information that was tailored just to her.